And so welcome everyone. I am so excited to have you all here. And I want to introduce you to my friend Sandra Arill, who is just an awesome hygienist. And she is down in the Miami area. So they're having a little storm down there. So just, if, hopefully technology will be good.
Yes.
Let's save our questions till the end. She's got lots and lots of information. And let me have you mute yourselves, and please send me a private chat so that I know who, if I don't have your last name, who all of you are. All right, and whoever 516 is, please mute yourself. All right. So, Sandra, welcome, and take it away.
Hi, everybody. Thank you, Barbara. I'm thrilled to be invited to talk to this group about herbalism. I'm passionate about herbs. I've been a hygienist for 35 years in clinical practice. I am not a biological hygienist, although I would like to be. Barbara's coaching me. I've been practicing herbalism for about 5 years. I was introduced to it by my daughter, Sophia, who was studying at the University of Florida, and she volunteered at the Florida Herbal Conference. And she called me very excited and said, "Mom, this is for you. Mark your calendar. You got to come to this next year. You belong here." And Sophia knew I was an herbalist, but I didn't know it yet. I always look for natural methods, ways of treating their sicknesses, and just wanted to keep everything healthy. And I was drawn to nature. So fast forward, I followed her advice. I went to the conference the following year, and I fell in love and with the plants and the herbs and the whole herbal community. Herbalist has taught me a lot about practicing more holistically, with the intake when I see my patients. And I'm slowly trying to incorporate it in my dental practice. I do work in a traditional dental practice, so it's kind of, I have my little side thing where I see what the patients want, and a lot of them are open to my suggestions. So I go from there. There's endless amount of information about herbalism. So I try to condense an introduction and give you a glimpse, focusing on a handful of herbs that can be used for oral health. This is just an introduction. And if you want to dig deeper, I'm happy to recommend, or like Barbara said, maybe we can do another session and, talk about other aspects of herbs. And if you have any questions, we'll do it at the end. And if I don't get to it, you can email me. Let me see here. Okay. So the learning objectives, will define herbalism, we'll name herbs to support oral health. Like I said, a handful of them. I do want to mention here the book, Dental Herbalism, Natural Therapies for the Mouth. It's a very comprehensive dental herb book. It's pretty much, there's not a whole lot of them. This is the main one. It's excellent. I got a lot of my information from this book. I have it on my Kindle. So sometimes at work, I look up something right there on my phone. So excellent book. We'll talk about herbal preparations that enhance oral health, provide a practical approach to herbal interventions to use at home, and select herbs according to their properties and actions, and recommend herbs for dental anxiety. So what is herbalism? Herbalism is the practice of using plants as medicine to holistically support the body, mind, and spirit. This definition was taught to me by my mentor and teacher, Emily Ruff. And I wanted to emphasize the part about holistically, because that's how I like to practice herbalism. And I think you guys are, you're biological hygienists, so you know what this is all about. I don't want to just recommend an herb for this or that. I want to ask questions, be the investigator, and find out if their whole body, mind, spirit, if it's all, everything is in place to have better health. So what is the herbalist holistic perspective of health? And it's a perspective that honors the body as a whole being in relationship to its environment. It's considering our physical, emotional, mental, and spiritual health, as well as our connection to nature with our plants and animals. We want to have a whole body approach. We want to get to the root of the problem, want to ask questions, consider like a patient's systemic conditions. Are they taking medicines that are causing another problem or that are going to interact with the herbs that we may want to recommend? Their diet and hydration. Are they eating real foods? Are hydrating, plenty of water? And hydration also includes fats and oils that we need for our bodies. Exercise. We need to exercise. Tammy Sweet, a great herbalist, says that if she's also an anatomy teacher, she says if our body's not moving, our cells think we're decaying. So at least 20 minutes a day, right? That's doable. Sleep, rest, breathing. This could be in form of meditation or just silence, just taking deep breaths, getting plenty of sleep. There's a herbalist, Saja Popham. He recommends sleep therapy to people that are sleep deprived. And that's like sleeping 8 hours during the week. And during the weekend, you rest for 12 hours. So you stay in bed for 12 hours. You can get up to go to the bathroom, but you have to stay in bed. I'm like, I want to do that. And don't just take this for that, which is what we talked about earlier, is getting to the root of the problem. Don't just put a Band-Aid on it. So this is a picture of the garden I used to have. I now live in an apartment, so I miss my garden. But here you can see I had a raised bed and I had all this medicine in it. And I have lemon balm here and sage. I have culantro, tarragon, thyme, monarda. These are dry herbs. I was making an elderberry syrup. I have elderberry, rosehip, ginger, cinnamon, honey. And I always try to use fresh herbs if I have them. If not, I get dry herbs. But I always try to use organic herbs when I'm making medicine. There's several really good companies that you can get your herbs from if you can't grow them. And I will give those resources at the end of the presentation. And also you'll learn, if you get into it, you'll know when to use fresh herbs or when to use dry herbs. So you can pretty much use dry herbs most of the time. So benefits of herbalism. Hygienists have the power to heal, right? We're in the perfect business to introduce herbal medicine, herbal methods. A lot of our patients only see us. We're the only healthcare provider they see because they don't get checked, or they don't want to, or they don't believe in the system. It's for those of us who seek a more pure and natural way of living by incorporating herbs into disease prevention and well-being. Herbalism offers simple solutions available and accessible for everyone. It brings us back to the methods our ancestors used. I'm sure we all have herbal recipes from our grandmother or our mother. There's room and need for both modern medicine and herbal methods for healing and prevention, and plants are here on earth to support us and work with us. We need to connect with them. They're our allies. And if we can find healing methods within our herbal friends, why not try instead of jumping into a pill, a pharmaceutical, or a chemical? So I love this quote. It's easier to stay healthy than treat sickness. I looked it up to see who came up with this quote. I couldn't find it, but there's different versions of it. And I feel like this is prevention, right? This is, if we pay more attention to our symptoms and our lifestyle and our diet and our emotional state. And we try to create a balance and we have a greater chance of staying healthy and avoiding poor health conditions. It's also more economical to stay healthy. So a quick takeaway, herbalism is using plants as medicine. Plants are easily and economically available to all of us. There's room and need for both modern medicine and herbal methods of healing and prevention, and hygienists are in the perfect setting to introduce herbal medicine to our clients. So let's talk about the actual herbs. Herbs have actions, and if you look into herbalism, you'll see mention herbal properties and herbal actions. They kind of go together. So here I'm just going to talk about actions. And herbal actions tell us how the plant shifts our physiology and how a plant impacts our systems. And plants do this through their chemical compounds known as constituents, which I'm not going to cover the chemistry of, the constituent part on this. But if you're into the chemistry and you want to look into that more, I can recommend books about it. But this is basically how we determine what plants we want to use for a certain condition by their herbal action. So some of these are just some of them that I chose for this presentation. Astringent, that is a plant, that means it generates dryness. It increases tightness, for instance, to the gingival tissue. So that's why, I'm bringing it up now. It's good for oral health. And some examples of that are like calendula and rosemary, sage, turmeric, cinnamon. Those are all plants that are astringent. Sorry, I hit the wrong one. Anti-inflammatory. Well, we all know about anti-inflammatory. We know about turmeric is anti-inflammatory. That's a real popular one. And you will see that a lot of the herbs I'm going to talk about today have similar actions, which is great because if you don't have one, you can choose another. Or if somebody doesn't like the taste of one, you can, you have plenty of choices. Or you can find one herb that covers several conditions or several symptoms that you want to treat. Antimicrobial, that's really important in our field. They help balance the microbial population. Vulnerary, I love vulnerary herbs, and these are herbs that aid in wound healing. Calendula is a big vulnerary herb. Chamomile is vulnerary. So they help us, help wounds heal more rapidly. Demulcents is another important one for us because demulcent herbs, what it means is they're mucilaginous. When they come in contact with water, they become slippery and slimy. So they provide moisture and soothing action to the tissue and the mucous membrane. So these are great herbs for dry mouth or for the GI when it's that burning. In fact, for your granddaughter or your daughter, I think it was your granddaughter, maybe something soothing like marshmallow. It also tastes very sweet. So those are demulcent herbs. Circulatory stimulants, these are herbs that stimulate circulation, and they're usually provide a little bit of heat. So like rosemary, cinnamon, capsicum, which is in cayenne pepper. Nervines, these are also great for our nervous patients, for anybody. They address stress, fatigue, insomnia, anxiety, tension. They're for nervous system exhaustion. And some of these are like chamomile. That's why it's also soothing for the tummy. Holy basil, lavender, lemon balm. These are all nervine herbs. Adaptogen kind of goes with the nervines. Adaptogens, they address stress. They improve the body's internal and external. They help us fight stressors. So they help the body's response to stress. Some of these are holy basil and ashwagandha. And these are some that you can recommend to our patients. I mean, everybody's stressed out. So I love holy basil. It's like my plant to go for as an adaptogen. Diaphragmatics, these are pretty cool. These help to relax constriction of the blood vessels to release heat during a fever and promote sweating. And I will talk a little bit more later when we talk about herbs that are diaphoretics, but you can take this for a fever. And a good example is lemon balm, which is very mild, and you can give it to children too. And it tastes good compared to other diaphoretic herbs. And antispasmodic, these are herbs that ease involuntary muscle contraction. They're good for colicky babies and tummy aches. So an example of this is chamomile. So let's see. Okay, so quick takeaway with herbal actions. They help us determine which herbs to use and recommend. They tell us how a plant impacts our system. Medicinal herbs have more than one herbal action, and knowing herbal actions help us choose one herb to cover several symptoms. Okay, so these are some herbal remedies. These are some that are these are the more common ones that we may have heard of or not. I'm going to talk about the ones that I have in bold letters because I don't have time to talk about all of them, but we can save that for another time. And the first one I wanted to talk about was here. I have menstruum. This is not a remedy. I just wanted to bring it up. Menstruum refers to the liquid used to extract herbal medicine. For example, water, alcohol, oil, honey, just to name a few. So when you hear me talk about the menstruum, that's what I mean. For instance, in tea, we all know what a tea is. The menstruum is water. So a tea or tisane is a water infusion or extraction of herbal medicine using water. So that's just one of the remedies we're going to talk about, and that is the most common. And usually a tea is made with hot water. And you can put like I like to use 1 to 2 teaspoons in a cup, hot water. You let it steep for 5 to 15 minutes. And there you have your medicine. So this is the easiest way to make herbal medicine. A decoction here is similar to a tea, but it's used when we want to get medicine out of the hard parts of the plant. For instance, maybe the stem or maybe the root. Maybe it's just a harder plant, so we need to get deeper in there. So instead of just making the regular tea, we're gonna simmer this plant slowly for like 20 to 45 minutes in water, very slowly, because you don't want to kill the medicine. Another thing way you can do a decoction is to steep it overnight. So you would put it in a jar, put hot water, seal the jar, and just leave it overnight. And that's also a recommended way of doing a decoction. Food, back up here. Well, we use medicinal herbs when we cook. We do it right now. We may not even know it. When we use oregano, basil, garlic, rosemary, it doesn't just taste wonderful. It's medicine for our health and immunity. When we use cayenne pepper or hot peppers, if we like that, well, the capsaicin is what gives the chili peppers heat. It's rich in antioxidants, vitamins, minerals. It also gets our blood flowing, right? And then turmeric, we talked about that earlier. Everybody knows turmeric is anti-inflammatory. It's also antioxidant. And I've included 2 books, Healing Spices and the Herbal Kitchen, and I'll have them named at the end. And those are great books if you want to, cook with medicinal spices and herbs. So that's an easy way also to incorporate herbs into our daily lives. So next I want to go to Another one I want to talk about now is poultice here. And a poultice, Barbara, we were talking about it earlier. A poultice is a mass of fresh or dry herbs, and you can use either water, or you can use a tea, or you can use an oil, and or even saliva, and you just basically wet it and you apply it on the area. So you can apply it on a cut, or you can apply it in the mouth for bleeding gums, or for inflammation. You can make a poultice of like turmeric. I mean, your tooth may turn yellow for a while, but it's another way of delivering the herbal medicine directly on the mouth. It's very useful for the mouth. I cut my finger, and it was one of those cuts, I could not get it to stop bleeding. And luckily in my herbal apothecary, I had yarrow, which is an herb that is used, is styptic. So it's known for, it stops the bleeding. So I got some herb, I just wetted it, I stuck it on my cut, I wrapped the Band-Aid around it to keep it in place, and finally stopped bleeding. So herbs are magic. So what I'm going to do now is I'm going to go to talk about some herbs while we make other remedies. So you'll get to know about the herb and also know about a remedy that we can use it for. These are some of the herbs I'm going to try to cover today. A lot of these herbs are in the same family of herbs, and a lot of these herbs you have in the kitchen. So they're pretty accessible. Materia Medica, you'll hear me talk about Materia Medica, and Materia Medica is an organized written collection of plant specifics that herbalists get through their research and experiences. So it's an ongoing document, and you can have this on a notebook. I like to keep it on my computer because then I can keep adding information, and it's just the facts about herbs, the specifics. And I like to also add a picture. I like to put any scientific studies. So it's just a reference. And if you have it on your computer, you can access it on your smartphone. So some of the items you see on a Materia Medica would be something like plant name, botanical name, plant family, parts used, the herbal actions, the herbal energetics. In this case, I did dental uses. There's major constituents, contraindications, very important, and then herbal preparation. So you can put whatever you can, and the more you have, the better. I did some slides with a little Materia Medica so you kind of see what it looks like. So we're going to start with peppermint. Everybody, we all know peppermint. It's used in many dental products for fresh breath. We use the leaves. Look at all the actions peppermint has. It's astringent, analgesic, antimicrobial, antioxidant. I mean, it's not just for good flavor. I want to point out here, febrifuge. So it helps reduce fever. We can do a poultice with peppermint on a side where there's gingival inflammation. You can use it, make a tea. Down here I have herbal preparations. Tea, you can make a tea and have a patient rinse after scaling and root planing, after an extraction. We do have to be cautious with people with GERD or acid reflux because it can be irritating to the GI tract. It can be used for halitosis, gingivitis, canker sores, herpes. So what I did here, I used peppermint to make a tincture. And I want to talk about tinctures now. Tincture is another remedy. It's one of my favorite remedies because I can take it anywhere. It's pretty easy to make if you wanted to make some. If you don't want to make it, you can buy a tincture. A lot of health food stores have it. You will see little dropper bottles like this of tinctures. And a tincture is basically an alcohol extraction. If somebody cannot take alcohol, or like a child, you could also use glycerin, you could use vinegar for the extraction. So the menstruum here, remember the menstruum is what we use to extract, is alcohol. It's actually alcohol and water, because alcohol, like for instance, this alcohol was 40% alcohol. So it's 60% water. But you don't have to worry about that. You can just use 40, at least it has to be 40% alcohol or higher. And as you get deeper into it, you will see that herbalists recommend certain percentages for certain herbs, because you get a better extraction. But that's a little more advanced once you start, getting into making the medicine, and it's a lot of fun. I like making medicine. It's like cooking and like science lab. So here what I did was, I have the peppermint. I figure out how much peppermint I'm going to use. I have the dry herb. You can use fresh herb also. I pour the alcohol on top of it. I cover it. I label it. Make sure you label, because you're not going to remember what herb was in there. So you want to put the date, how much herb, put as much information as you can, so you can go back and see what you did once you made that medicine. And once you have it all mixed, you put it in a cabinet. You put it away in a dry, cool place. It's good to move it around every day if you can. Say a little herbal prayer. Thank Mother Earth for the medicine. And after 28 days, you strain it and you have medicine. So here I made a peppermint tincture. With this peppermint, again, label it. With this peppermint tincture, I can add it to water and do a little mouth rinse, or you can take it internally as medicine. You can add it to a water pick. It does have alcohol, so if you don't want alcohol, then you don't want to use it. And this is something that you would use temporarily. It's not like I'm going to use this peppermint tincture every day. I don't like to use anything forever, unless it's something like a vitamin that we are lacking and we need to take every day. But if you're treating something with herbs, I think you need to look a little deeper if it's something that is not getting better, right? So, okay, the next herb I want to talk about is sage. There's also, I want to mention, I do have some studies at the end of the presentation. I didn't include them in the slides, but a lot of these herbs are in the studies, and there's plenty of studies on herbs, especially sage. It just kept popping up. There's tons of studies with sage. Also, it's anti-inflammatory, it's antiseptic. One of the actions I want to mention here is that it's emmenagogue, meaning that it stimulates and increases menstrual flow. So, if that's something you want to consider when you're recommending sage, if there's a menstrual flow issue, then, you have to consider that. Also, pregnancy. It's anti-galactagogue. That means it can dry up breast milk. So you don't want to give sage to a pregnant, or nursing mother. I would just stay away from it with pregnancy. And there's a lot of herbs that have contraindications with pregnancy. And if you want a list of them, email me and I'll provide it for you, because there's many herbs that we don't even think about, like sage. I didn't know that it would dry up breast milk. So you want to be careful with that. We can use it to treat gingivitis, canker sores, excellent for mouth rinse. You can use it, make a tea, a tincture, powder, take capsules. I actually use sage for a little bit of like a heartburn that I get, because it is a good tonic for my digestive system. And what I did here is I made an herbal tooth powder. And this was a lot of fun. I had never done it before. So actually preparing for this presentation, I finally got to do it. And a tooth powder is an alternative to toothpaste. It's an easy way to incorporate a variety of herbs with specific actions. So you can use several herbs. In this case, I use sage. It's economical, it's easy to carry, and you can just put a little tooth powder on your palm of your hand. You wet your toothbrush and put it on there and just brush with it. And sage tastes great. And so it cleans the mouth. It gives your mouth a really nice, clean, good flavor. It you can use a little chew stick or a toothpick or your finger. If you go camping or something, you can just bring some herbal tooth powder. And here the recipe I used 1 part arrowroot, 1 part baking soda, 1 part sage powder. You see it right over here. And then a pinch of salt. Make sure you label it. And it was great tasting. It's a great way to incorporate herbs also into our herbal toolkit. So here we're going to talk about thyme, another herb that was popping up a lot. There's a lot of studies done with thyme. Is antimicrobial, antifungal, antiviral. It's very powerful and tastes great. A lot of us have it in the kitchen. Also stimulates and increases menstrual flow. I saw a study where they used thyme and honey. They used the thyme and honey to for people that were going through head and neck cancer radiation, and they had really good results with that. They made a rinse with thyme honey, and it was very soothing. It kind of stimulated the secretions of saliva, so they had really good results with it. A lot of times we see thymol in a lot of herbal products, and that's the essential oil of thyme. Essential oil is a little different. I'll talk a little bit more about that later. But you can use the thyme oil added to certain preparations, but you got to be careful with the essential oils. And here I'm going to use thyme to make an oral rinse and combine it with calendula. I don't know if you remember when I talked earlier about vulnerary herbs. Calendula is excellent. You'll see it in a lot of skincare products because it helps the skin. You can see it on lip balm. You can, if you have a cream of calendula, it helps with healing. Or a calendula oil or a salve. A salve is an oil that has been added. You add beeswax to it and it makes it a little firmer, like a lip balm. Calendula is, you can make an infusion and use it as a mouth rinse or a gargle. You can use it for bruises, burns, dry skin, eczema, hemorrhoids. It also helps soothing the GI tract. Maybe that's another one that you can consider for your granddaughter. But you got to, I can recommend you a book if you write to me on herbs for children. So write to me and I will recommend a book about that. So here I made a mouth rinse, and this is a 2-part recipe, and it's not that complicated, but I know people don't want to do a lot of work. I have patients that would rather just go buy it, but there's options for that too. So here I made a water infusion, a tea of calendula and thyme, and I made it in I love this little tea kettle I have. It's like for one, it's like 10 ounces, I think, or 12. So I made the tea. I steeped it for 10 to 15 minutes. And then separately, I made a saline solution, like a brine. And this was a recipe that I got from the Holistic Dental Care book. Barbara, I think you're familiar with this book. I saw it on your blog by Nadine Artemis. That was the other dental book, like holistic dental book I found. And I love this idea because she recommends just putting salt in like a mason jar, like I did here, of a pint. You put hot water, you seal it, and it creates like a brine. And then you can have, you let it cool, and then you can have that sitting around. She recommends just rinsing with that after meals to, just, it's anti-inflammatory and it just cleans the mouth. And in this case, you can also add like 1 drop of essential oil if you wanted to. I didn't want to. But what I did here is, so I took equal parts of the tea and the saline solution. I added some baking soda and you shake it really good, and you have a great mouth rinse. And you can add any herbs that you want for whatever it is that you're trying to do. I gave it to my cousin. Barbara's familiar with my cousin who's visiting, getting dental work done because she has severe dry mouth. Like your granddaughter, she had a bunch of cavities, and she went to a functional doctor. We're still trying to see what's going on systemically because she had like 18 cavities as an adult. Anyway, so I gave her this mouth rinse to use, and she loved it. She said her mouth just felt clean, moist, refreshed. She said, I feel like I just had my teeth cleaned. So, so this is another way this is a way to make a mouth rinse. And this is marshmallow. This is the one that is demulcent. Remember, the demulcent herbs are the ones that when they come in contact with water, they become moist and slippery. They're cooling and moistening. So a mouth rinse of this for the dry mouth is very soothing. You can also, you drink marshmallow tea to soothe the GI tract. So maybe for your, I think I mentioned that before, for your granddaughter. Let's see. So here, what I did with the marshmallow is I made a cold infusion because plants that are demulcents are better in a cold infusion. You don't want to use hot water like the other herbs. And you steep it for 10 minutes. And then you can keep any of these teas in the refrigerator for 3 days, like up to 3 days. And then you can just, make a new one after 3 days. But after 3 days, I don't think, you should. You can try it, but I don't. And then you can just rinse the mouth, and it just moisturizes the mucosa. So here I have 10 ounces of cold water and about 1 tablespoon of marshmallow root. You can also use marshmallow. Here I have a pastille. Pastille it's like a French word for making a pill out of honey and herb. So when I went back to work after quarantine with COVID, I don't know about you, but my throat would get so dry. I kept thinking, oh my God, I have COVID. It was because we had those NK95 masks that we couldn't even breathe. I talked to my herbal teacher, and she said, you're probably just breathing through your mouth to get air. That makes sense. And when you talk, you're breathing through your mouth a lot more. So my throat kept getting dry. So she recommended making a pastille with marshmallow root powder and honey. And basically what you do is you make little balls of it. You mix it, you make little balls. You put it on a baking sheet, and you bake it at very low heat, kind of like a dehydrator. I don't have a dehydrator, so I use the oven. You leave the door open, and you just bake it and watch it until it's until you can handle it, and pick it up, and it's not going to stick together. And then you just have, it's like a little lozenge that you can just suck on when your throat's dry, and it's soothing and tastes good. So that's another little thing you can make with marshmallow root. The next herb I want to talk about is lemon balm. How are we doing on time, Barbara?
We've got about 12 minutes.
12 minutes. Oh, wow.
Yeah, I know.
Okay.
It goes fast.
Oh, I'm really fast. Okay, I'm going to go a little faster. Lemon balm. This is really, this is my plant ally. I love lemon balm. It's a nervine. So it's great to take for, for nervousness. It's great for sleeping. It's antiviral. That was the main thing I wanted to talk about here. Lemon balm is antiviral. So it's used, and there's a lot of studies, and there's a study at the end where they used it for treating cold sores. And the remedy I wanted to make here is I made a infused honey. And this was an idea given to me by one of my herbal teachers that would make a honey medicine with lemon balm for her nephew who would get cold sores. And it's good because it's sticky. So it will stick on his lip and provide the medicine. So this is another way to extract medicine, and you can use this for cooking. And here I also provided you this blog of mountain rose herbs. They have excellent recipes for making herbal medicine. And you fill half a clean jar with herb, you add honey, you put it on your like a warm windowsill for like 1 to 4 weeks. I would do it for 4 weeks because it draws out more medicine. And you have to shake it, or maybe you have to open it and mix it up because maybe even add a little more honey. But it's a great way to make honey with herbs, to infuse honey with herbs. And if you use powder herbs, you don't even have to strain it. You can just leave it in there and apply it. And also I use honey to make facial skincare products. You can use cleansers with adding powder herbs to honey and wash your face with that. It's a great cleanser. And I do want to mention that lemon balm, it is contraindicated in persons that have hypothyroid because it can lower your thyroid. So you don't want to give it to someone that's hypothyroid. And if they're hyperthyroid and they're on medication, it could add on to the effect of the medication. So be careful with that. Lavender, we all love lavender. It smells great, but not only does it smell great, it is analgesic. It's great for oral health. It's antifungal. It's relaxing. You can use it as a mouth rinse. I like to use lavender for my patients when they come in with anxiety, which is, we know a lot of people like that. And what I've done here is I made an infused oil with lavender. This is another method of extracting herbs. Is the oil in this case is the menstruum. So you take the flower and you put oil and you leave it by the window for 1 to 4 weeks. You want it to get some sun, some heat. And after 28 days or 4 weeks, you strain it and you have an infused oil. This is different from an essential oil. So here in this situation, I use lavender flowers and jojoba oil, which is great for the skin. And then I took that oil and I added flower essence, rescue remedy. It's good, which is good for anxiety and fear. I add like 4 drops of that. And then I added a couple drops of essential oil to give it a little, it's like a little bonus with the scent and for the calming effect. And what I have is, this is my herbal little business that I have. And I have it in a little roller, but for the office, I have it in a dropper because I can't roll everybody with the same little roller. So I have it in a dropper and I take a few drops on my glove and I just put it on my finger. And of course, I ask the patient, they always say yes. And I just put a little bit of oil here and here. I go here behind the ears, on the neck, kind of rub it in there. And they just love it. They calm down. I put it on their wrist and then they can do this and have them smell it. And it's just like instant calming. So this is a great way I like to use herbal medicine for anxiety. So for anxiety, we have chamomile. They can have it as a tea, and we can have the lavender also at our office. Clove, it's another herb. Clove has eugenol, which is analgesic, and you can put clove essential oil on a carrier oil. So you want to add it to olive oil or you want to add it to coconut oil because you don't want to put it right on the skin. Even though I have read that they use pure clove oil, just like a little drop on a toothache, and it helps with the pain. And you can even take a little clove bud, one of these little buds, and just stick it there where the tooth is hurting. I actually tried that with my boyfriend, who is an endodontist. retired endodontist, and he had a cracked tooth, and he knew it because he knew he was eventually going to have it extracted, but he put it off. And one day he says, "Do you have anything for pain?" I thought it was pretty funny. He was asking me. So we put clove oil. I gave him some other herb for pain, and it took the pain away for like 12 hours. You know, it came back slowly, but at that moment, it really did give him the analgesic effect. So herbs are very powerful. I want to talk about essential oils really quick because they're very popular, but they're very, you have to treat them with respect. It's a concentrated extract of an herb. It's not the same as the infused oil, and it's not the same as the plant. They can be irritating to the skin and the mucous membrane. They can be toxic if used internally. You'll see them used in skincare products and in aromatherapy, which they don't use necessarily the same oils that we would use for ourselves, for our body. So you got to be careful with that. It's not the same thing. And if you want to, you know, find out about the safety, the National Association for Holistic Aromatherapy, they offer information about uses and safety of aromatic plants and essential oils. And I hear people all the time say, "Oh yeah, I was giving it to my mother in the mouth," or they're just applying it straight up. You can't do that. You have to use a carry-all. You have to be very careful and really find out, you know, if it's safe to use. And should I keep going, Barbara, or just I can just skip to the end? This is another recipe if you want to just take a picture of it. It's overnight infusion, kind of like I talked about the decoction. This one is great. With this recipe, we are using dandelion, which is great for the digestive system. So we're treating, you know, maybe this person is not digesting well. We're using nettle, which is rich in calcium, iron, magnesium. Nettle is a great nourishing herb that you can take every day. And horsetail has silica, so it's great for the teeth. So this is a great remedy for people that are getting a lot of cavities and just for whole body health. I take nettle and horsetail often because I want to take it for my nails and my hair. And the nettle is very nourishing. It kind of nettle gives you a little bit of energy too. So there's many ways of using medicinal herbs for healing and well-being. Herbal remedies can be simple. They can be more economical than pharmaceutical remedies. They can be made right in our kitchen. And they give us an opportunity to combine a variety of herbs. You can, for tinctures, you can make different tinctures and make a formula, and you will see formulas of tinctures for different conditions or, you know, different ways of treating whatever it is that, you know, for immunity, you'll see a combination of different herbs, and you can purchase them like that, or if you get into it, you can make your own. These are some of the other herbs that I was going to talk about. Chamomiles, great mixing with lemon balm for sleeping. Also, I have, let's see, holy basil. I talked about that. It's a great adaptogen. I'll let you take a picture of it. Rosemary, great for cooking, but it's also very medicinal. It has a lot of medicine. A lot of these plants in the mint family have similar actions, so you can combine them well. Aloe vera, soothing, great for you can apply it on the irritated tissue for gingivitis, mouth burns, skin burns. Rose hips, high in vitamin C, used in a lot of cosmetics, also good for the mouth. You can make a jelly too, excellent, full of vitamin C, great herb to use. Turmeric, anti-inflammatory. Spolantis, this is really neat. This is called the toothache plant. And these little buds, I think you can use it's the flowers and the leaves. These little buds, you chew on it and it numbs your mouth. It tingles, like if you put topical anesthetic on. It's really cool. I used to have one. I made a tincture. You swish around with it with some water, and the whole mouth is like the little ants in your mouth. It doesn't taste the greatest, but I love giving it to people and say, here, try this. And all my friends and my coworkers, they just try whatever I give them. I'm like, I need to know what you think. They're like, oh, my guinea pigs. And then I watch their face. They're like, but it is pretty cool. And there's a study there too. It's very good for its antibacterial, antifungal properties. Echinacea. We all know echinacea is great for the immune system. We don't want to use it for too long of a period of time, but excellent. Also, you can make a mouth rinse. It's good to treat oral infections. And here are some ways you will see tinctures at the store. This is Whole Foods has this brand. This is Mountain Rose Herbs. They have tinctures. This is my little brand. This is a coffee blueberry bitters. It's good for digestion. These are toothpaste. Barbara, you asked me to talk about some of these. I use Boca. I love it. I have not used this, but I do recommend it. They have the one for children with the hydroxyapatite. This with biocidin, I actually used this. My functional doctor recommended it because I was having like burning mouth syndrome, and it was very soothing. It's very nice. It has a bunch of different herbs, and this one has it's a probiotic. So I'm really curious about that. I have not used it, but it sounds amazing. Do you use this one, Barbara?
I do use it. I like all 4 of them. They're all excellent.
Yeah.
Okay, we're getting down to the last. So how much more do you have?
I don't have, I just have, these are the book resources, and I'm happy to, this is just I'll just go through these. These are book resources that I use for my presentation, also that I recommend. More book resources, herbal education. And I can send you this if anybody wants it. These are schools that I recommend for taking herbal classes. Nowadays, you can take a lot of online classes, which is great. And I'm sure wherever you are, there's herbal schools that you can take classes from. But if you can, you do have the option of taking classes online. Some of my herbal mentors that I've taken classes from. Herbal resources, you can buy herbs in these. These are good, reputable places to buy herbs, organic herbs. And let's see, other herbal resources, the American Herbalist Guild, United Plant Savers, Flower Essence Society. This is the association to check the essential oils. And then these are some studies, and I'll be happy to send you these studies about the different herbs. This is my dog who eats holy basil. She loves it. It's the only herb she eats. I don't know why, but it must be good. And this is my mom and I, my daughter Sophia, who introduced me to herbalism, my other daughter. We have these botanical gardens in Miami that I love. And now that I live in an apartment, I get to go there and live, see my plant friends. And thank you.
Yay.
This went by fast. I mean, like, I was.
Excellent. All right. Thank you, Sandra. That was.
You're welcome.
It is amazing how much, that we should be looking at plants to help us heal. So
yes,
very good.
Definitely.
All right. So I know I saw one question. Let me get the gallery up here. So we've got one question in the chat, and then we can go if people have more questions. So let me find.
Okay. And you can always email me with your questions.
All right. So from Elna.
No.
Yeah.
Sorry.
Yeah.
It's my alarm again. Fire alarm.
Well, at least it waited till the end.
I know.
So
good time.
Good. All right. So Elena's question was, what percentage of the tincture would you use in a mouthwash with peppermint?
Oh, I would use, like, for instance, like an ounce, like a shot glass, let's say. Okay. I would use like half a dropper.
Okay.
Half a dropper full of the tincture.
And then a shot glass full
and then
of water.
And you switch around with it. Yeah,
Okay, all
a
right.
dropper full.
Dawn said we should have an herbal tea party at the next IAOMT
Yes,
luncheon.
yes.
We could, I love that. That's a great idea, Dawn. And then somebody wanted to know if you are on social media or where they can find you. So
I am. I have my Instagram. I'm on Facebook, but if Instagram would be the best. So this is Ayla Essentials is my herbal business. I have some remedies. Also, I wanted to mention that if there's something you're interested in, like some kind of tincture that you can't find, reach out to me because I have a lot of tinctures. I don't have them on my Instagram page or on my flyer, but I can make custom made stuff. And they're very reasonably priced. And so these are my two Instagram pages. This is my personal one. I do post some stuff, but the medicine is mainly on Ayla Essentials. But either one, you can reach out to me. You can find me there.
Okay, excellent.
I'm trying to become more active in social media, right, Barbara?
God, that is so hard.
Oh,
I'm too
you're
old
good
for that one.
You're very good. You're
well,
always on Facebook.
well,
I need
Facebook,
to, yeah, I need to be better about that. It's the time.
Yeah,
I do work 4 days a week, by the way.
Oh my gosh.
So
good.
I'm trying to cut back.
Well, yes, I hear you. All right. Anybody else have any questions? Just pop in. You can unmute yourself. And anybody have a question? All right. All right, you guys. So
question, Barbara.
Yes. Hi, Elna.
Hi. How are you?
I'm good.
Yeah, thank you. Thank you for a lovely presentation. I just want to know about the abrasivity when you make the toothpaste with the bicarb and all the things you put together. Has anybody tested the abrasivity of that?
The powder that I made, no, I have not tested that. I know that baking soda is not abrasive, and I don't know about the salt, and the powder is very fine, and we're wetting it too. We're not just putting dry on it. But no, I have not tested the abrasiveness of the powder. No,
once you wet baking soda, it is the gentlest.
Yes.
It's just that when it's dry, it's abrasive. But once you wet it with saliva or oil or something, it is very probably right. It's like 7 on the RDA scale.
Yeah.
So
Thank you.
Baking soda gets a bad rap, but it really
I know.
is.
I used to think it was very abrasive, and then I found out that it wasn't. Maybe they were just they didn't want people to use it. They wanted to buy toothpaste.
Yeah.
I wanted to ask a question about that because we looked up the RDA at our office as well, and it's really low. And I feel like I remember in dental hygiene school learning that, baking soda is abrasive.
Yeah.
So my doctor I work with, I was like, hey, what'd y'all learn? She was like, that it's abrasive. And then you go look it up and it's not. We were curious, like, when did that kind of get started? As far as, does anybody know when they were like, baking soda is bad?
I remember hearing the same thing, and I remember having a patient telling me they used it. I was like, no, you can't use that. That's so abrasive,
Yeah, that was when we implemented the microscope years ago. That was probably the second thing I noticed is people who use baking soda as their toothpaste or in their toothpaste overall have better biofilms.
Yeah.
So definitely we need to recommend it more.
Yeah, baking soda is awesome. So it's just got to be wet. It's the people who would wet their toothbrush and then they would dunk it in the box. And so they would still have dry baking soda at the end. And that was a little bit more abrasive. But once you wet it, then it is no longer abrasive. So they just need to make a slurry of it.
Cool.
Thank you.
All right. So this will be, it is recorded today, and then it will be edited and put on the IAOMT. If you go to the professional members box, and then go from there to education and then to webinars. So we will have this recorded if you want to come back and listen to it again. And next, we're going to skip July's CE course, and we'll have Shirley Gutkowski talk in August on myofunctional disorders and breathing and airway. And then we'll skip September because we're hopefully all going to be in Phoenix in September. So I'm looking for speakers for October, November, and December. If you have some suggestions, and you know, we're working hard to get lots of information for you guys. So any questions, let me know, and we can do a question and answer. Whatever you need, we are here to help you grow your biological business. So Sandra, thank you so much. It was wonderful. I had no idea that the herbs were so, you know, potent.
Powerful, yeah.
We're missing out by not using more natural remedies. So
thank you for giving me this opportunity. I really appreciate it. And
well,
again, anybody wants to, you have any questions, there's my email, feel free. And I would love some feedback too. This was my first official presentation. So.
Yay, well, you did great. So,
I was really nervous, but thank you so much. I really appreciate it.
There's sure so much more we could learn from you,
so. And this is a great group. I really enjoy learning from you. Thank you so much, Barbara. I really appreciate it. Yeah, you liked it.
I did. I love it. I love it. You know, I had no idea that there was such a connection.
Yeah.
So
definitely.
So that was why I wanted you to do this, because
totally. I can totally see the connection, and you know, you have the perfect group for this. That wants to know, that can use this, because you know, other people are just are not aware like we are.
Yeah. And more natural, more gentle, and work with the body and work with nature. And
definitely.
So excellent.
And easy to access. So let me know, you know, stay in touch. Let me know what you were gonna tell me about that herb for the amoebas.
Yeah, let me, it's on my desk somewhere. So I will email that to you and see what you think about that one.
Yeah. Okay. So. And if you think of anything that we can, you know, that you want to kind of look into it, let me know. Like, hey, you know, how about an herbal remedy for this? Or, you know, we can definitely look into the scientific part of it, which is what you're doing with the microscope and all that.
Yeah. I mean, that's what I did with actually dental side and LS is I took a plaque sample, divided it in two, and had the controls portion of the plaque. And then I put a drop of dental side and LS, and it killed all the bad bacteria.
Cool.
Yeah, dental sidin is biocidin.
Yeah,
and it worked very well.
Yeah.
You know, and their research study says that it does not kill the good bacteria.
Good, right? That's important.
That is important. You know, we need to not just wipe everything out, because that kills the bacteria that make nitric oxide in the mouth.
Right.
And you know, all the things that we're just killing. We need to feed the good bacteria. So
they need to change the school programs.
Well, that's why I want to start a biological hygiene mini residency. I want to groundswell. You know, that's the beauty of the IAOMT is, you know, these are at least hygienists that are interested in learning more and working with the body and healing from within.
Sign me up.
Okay, well, then sign up for the IAOMT and take the course. And
I'll have to check it out.
Yeah, please do. It you know, you'll learn a lot, and I'm hoping to, you know, my goal is to just, you know, have another level. So there's the entry level, so you're accredited, and then we'll have the fellowship level and the mastery level.
Excellent.
And that's where having that biological mini residency, you know, where we
definitely,
you know, I mean, I have a list 6 pages long of all the things that I want other hygienists to know. And it's an enormous list.
Yeah. One thing is learning it. Another thing is implementing it.
Yeah. Well, and that's, I mean, how do we take this information and use it on Monday?
Right. Right.
You know,
Yeah.
that's the thing is, you know, we've got 60 minutes for a hygiene appointment. We need to change that. So, you know, unfortunately, people don't want to pay for it, but
Right.
that's where, you know, we have so much information to share that we need to change the face of dental hygiene.
It's always so funny when you know, I tell so many people that, like, I have this friend, she's a biological hygienist, and I tell them about it, and they look at me like, what?
It's a thing. I
What?
know.
Like, what? It's not just it's not just brushing your teeth.
Yeah, no, I mean, it needs to not be.
Yeah.
You know, we need to have healthy plaque. You know, when I tell patients I want healthy plaque, they look at me like I just fell off the dark side of the moon. Like, plaque can be good. Like,
Yeah.
it has a purpose.
It can be, it can be the good bacteria that, you know, that are more abundant there than the bad ones.
Yeah, exactly. So,
Okay.
all right. Well, good.
Thank you. Stay in touch and let me know whatever. We'll be in touch. Okay.
All right.
Barbara.
Very good. All right. Mwah.
Bye.
All right. Take care, Sandra.
You
Thank
too.
you.